Thank you, Brother Chairman. Dr. Oz, welcome to you and your family. Congratulations on your nomination. I enjoyed our conversation the other day and finding out the friends that we have in common. My home state, Dr. Oz, the state of Georgia, is not only one of just 10 states in the country that still has not expanded Medicaid. It also has the dubious distinction of being the only state in the country where the limited number of families who do qualify for Medicaid are required to regularly complete bureaucratic paperwork to prove that they're still working the minimum number of hours to get health care. State officials call it Georgia Pathways to Coverage. I call it Georgia Pathways to Nowhere. The program is allowed under the state's Medicaid waiver, which is up for renewal this year. And if confirmed as head of CMS, you would be responsible for approving or denying the state's application to renew this onerous paperwork requirement. Dr. Oz, I'm not going to ask you to prejudge the state's renewal application. That wouldn't be fair. You need to see it. But since you would oversee Medicaid if confirmed, yes or no, do you believe that families should have to complete government paperwork every single month to prove that they're working just to get health care when they're sick?
Senator, I appreciate your question. I enjoyed visiting with you. My wife went to Union Theological for a while, different time than you. I brought her as a support staff.
Good.
To make sure.
That gives me comfort. Yes or no?
The answer to me is I am in favor of work requirements, and I don't believe we should allow.
Do you think a family should have to fill out paperwork every month just to get health care?
I don't think you need to use paperwork to prove a work requirement, and I don't think that should be used as an obstacle, a disingenuous effort to block people from getting on Medicaid. However, I believe we would both probably agree that there's value in work, and it doesn't have to be going to a job. It could be getting an education. It should be showing that you want to contribute to society. Frankly, you could volunteer at Ebenezer Baptist Church, where I did a show with you once. That would, for me, fulfill the requirement.
You'll never get any pushback from me about the value of a work ethic and the purpose that work provides, which is why I think people ought to have health care so they can get back to work. Very often they can't get back to work in Georgia because they can't get the health care. Let me give you an example. There is a woman in Dalton, Georgia that I got to know a while ago. Her name is Heather Payne. She's a traveling nurse. And, you know, as a traveling nurse, some jobs were better than others. Sometimes she had health care, sometimes she didn't. She was among those folks who were in the gap. She couldn't afford private insurance. But she wasn't poor enough to get conventional Medicaid. So her health challenges and the unpredictable nature of her work as a traveling nurse made it impossible for her to meet Georgia's onerous work verification requirements to get Medicaid. She found out she had had a series of strokes. She had to save the money to see a neurologist, and then she found out she'd had a series of strokes. Took a long time to be able to afford to go. And now she's in the gap, and she can't meet Georgia's onerous work requirements. Do you think Heather Payne, a traveling nurse who spent her career providing health care to others, do you think she deserves Medicaid or not?
Yes.
Thank you. I agree with you, and since we agree, I think that the Medicaid waiver that you will be responsible for reviewing, I think that Medicaid waiver, in fact, I know it, it says that Heather does not deserve Medicaid. Let me tell you about another Georgian. Amanda left her 2 jobs in New York and moved to Warner Robins, Georgia, to become a full-time caregiver for her 84-year-old father, Thomas. Taking care of her father has become a full-time responsibility for Amanda. He's 84 years old. She's taking care of him, which means he's not in a nursing home, by the way. She's taken on that responsibility. But with all of this, she doesn't have time to hold a full-time job that meets the state's strict work requirements, and she has no income to cover her own health care costs should she get sick. Dr. Oz, do you think Amanda deserves Medicaid?
From what you're describing, yes. These are the opportunities we have to make the system better. If we both agree that people should be trying to get off Medicaid if they can, we should be able to create a system where we can track that, because there's the twin paradox, which I think we touched on in the office. 2 brothers are at home. One's working every day, flipping burgers, making minimum wage. Maybe he's cobbling together $16,000, $17,000, puts him right above the poverty level. And the other brother doesn't bother working because he'll have the exact same coverage if he doesn't work. We want to make both of them want to move up the ladder. Like every small businessman, what's their goal? To become a big businessman.
So look, you and I have the basis, I hope, for a meaningful conversation. Georgia's pathways to coverage is a roadblock to care. They've literally gotten, I don't know, 6,000 people, I think, the last time I checked. And we got over 500,000 people in the gap. So I'm going to give you a softball. If you're confirmed, will you work with me and will you keep Amanda and Heather in mind as you consider whether or not to renew Georgia's waiver, which I think is filled with unnecessary and onerous work requirements, paperwork, filling out paperwork every single month. Will you keep these two people in mind? That's the question.
Heather and Amanda should be in all of our minds and many others like them. I look forward to working with you. Maybe if you'll invite me down on a Sunday, I'll come to church with you.
Thank you very much. You're invited any Sunday.
All right.
You can't preach, but you can come.
Senator Welch.